Thank you, Dr. Flores. I've come up to many of you when you were here interviewing and talked to you right in this room, and I've said, this is the best job I've ever had in my life, and it's 22 now, some years, and it's in part because the quality of people that I work with and I have for students. And what Dr. Flores just said was very, very inspiring to me, because it's speaking to something that I think we've been trying to do as teachers at Einstein, which is not just to teach you to be factually encyclopedic, but to develop as people as you develop the knowledge base that you're going to need to practice. And this is in fact what is part of what we're doing with the scrub ceremony and the events that are tied into it. I want to begin by mentioning to our class of 2015 about our PA program. This is a very special and, again, unique program at Einstein, because the people who are going to be your peer assistants for the next 4 months in this course are picked in a very special way. Most of the awards at Einstein are given for academic excellence, how well and how proficient you can score on exams. The PAs who are going to be working with you and mentoring you over the next 4 months also did extraordinarily well in the class. But equally, if not more important, they impressed their peers. They also impressed the lab faculty, because all three of these variables, how you did on your exams, but also who voted for you, because you're going to have a chance at the end of the class to indicate the people that you work with day in, day out in the lab as being the people you think would be the best peer assistants for the next year's class. And finally, the lab faculty, who are going to work with you and are looking for who are the leaders at the table, who are the people that step forward and help, who are the people that are going to be coming prepared, following instructions, and are the leaders within that team. And they indicate who they feel are the people that would best represent the class as the peer leaders for the following year. The clinical anatomy attendings is something that also grew out of what I think is the Einstein spirit. Your first introduction to the cadaver is not going to occur through an anatomist. These are practicing clinicians who practice all over our facilities in different Beth Israel, Montefiore, Bronx, Lebanon, who are committed to making certain that the kinds of mistakes that happened to them when they started anatomy are not going to happen to you, and that it's going to be humanistic, it's going to be sensitive, it's not going to be judgmental, it's not going to be presented to you as a test. It's going to be done from the point of view, this is your first patient. So you will be introduced today to your clinician, clinical anatomy attending, who is going to be the one that meets with you to introduce you to the cadaver patient that you're going to be working with. And that's going to occur sometime over the next 3 weeks. One of the things that your peer assistant is going to tell you during your meeting today, after you've joined with your team and you've gone off here to the side, is what is the date and time that your introduction to the cadaver patient is going to occur. And the peer assistant is going to give you a pin. It's like the one I'm wearing on my lapel. This was actually designed by students, it was now about 7 or 8 years ago, as a way of stating we've learned anatomy through the dissection of a cadaver patient, from whom we have learned lessons that we could never have learned any other way. And I would hope those of you who feel so privileged and at the end of the class will wear this out of reinforcement for having had the opportunity to do this. Anatomy is the basic of modern medical practice. It's been taught as a subject for well over 400 years. And for most of those years, it wasn't taught as a humanistic subject. It was taught as an encyclopedic volume of knowledge. How many names of the 4,327 structures that have a name in the body can you remember? Many of the people that you know in your family who were taught anatomy as part of their medical training 30, 40, maybe 50 years ago will tell you how they basically had to memorize Gray's Anatomy and promptly forgot 90% of it and never used anything of it. That's not what we're going to try and teach you in the anatomy class. What we're going to try and teach you is that the old method that then became more of a mentorship with teachers, that then evolved into small team-based learning where you work together with others as part of this experience, that transitioned into your becoming part of a healthcare team. Now we do it this way. This is Dr. Bruce Soloway, who's the vice chair of our Family and Community Medicine Department, who is one of our clinical anatomy attendings at one of our meetings, and this is almost identical to what you're going to have, different people. But when you meet the cadaver, you are going to meet the cadaver, your first patient, totally nude, in a supine position. You're going to see the face, you're going to see the hands, you're going to see the bed sores, you're going to see whatever surgical appliances or interventions that were left in the body at the time of death, and you're going to do a physical exam. And as you're doing the physical exam, the hope is that you're not just trying to identify, well, what was the procedure that was done to create this, but in part, as Dr. Flores was saying, to try and ask yourself, well, what did this patient go through as part of this? How did this affect their lives? How did it affect end of care activity? And you're going to be able to ask questions. And one of the most important things that I want everybody to believe, whatever it is you are feeling about this experience that you're going to have, it's okay. It's your feelings. There is no way you're ever going to communicate with anyone else who has feelings if you can't accept your own first. I have no judgment about what feeling is the appropriate one. If you're going to be a surgeon that you have to feel a particular way, you have to deal with your own feelings, and they are what you have. That's what you're bringing to the table. That's okay. All right, so our first meeting is actually going to be tomorrow night. We have 3 clinical anatomy attendings coming tomorrow night, and you will learn from your peer assistant exactly who those are. And they will tell you what lab you're in, and they will then be followed. We follow this up because during the course of the year, you are going to be writing a patient history where you're going to be recording things that you found that are unusual, anomalies, signs of surgery, signs of disease, and you're going to be coming up with hypotheses. Now, I think in many ways the cadaver is an ideal first patient because all your hypotheses could be true. Therefore, it's not, again, am I correct or am I wrong? It's how can I use my powers of observations and my analytical abilities to come up with as many options as might be the case. And often coming up with many hypotheses is more important than trying to come up with the correct one at the first try. So we want you to generate a hypothesis about not just what this would have been like for the person, but also some of the things that it may have affected in terms of their quality of life. And, let me go back to that. In January, you're all going to meet as a team with your clinical anatomy attending to kind of have a little bedside rounds, not in the anatomy lab, but to go through what did you learn about having dissected the trunk and part of the head, about this person and what they taught you from their physical findings. All right, now we're getting into the fun part. I'd like to thank all of our alumni for getting in a lot of exercise here and presenting the scrubs to our students. And we'll look forward to seeing you here over the next month as you come to visit the anatomy lab. Thank you very much.